Hello guys, Vanakkam and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and lesson OET training. And now we are watching Magic Pill session. So it is the session where we are discussing every day 5 questions, which is going to be very much useful for you for the upcoming NORCET as well as JIPMER examination. Let's begin the session without wasting the time. And today we are going to start with nursing education. So definitely in each and every examination, at least 2 to 3 questions you can expect from the nursing education. So it is very important topic. So let's see in detail about the previously asked question from JIPMER and AIIMS NORCET. Okay, so the first question start with a method in which several rounds of questions given to a panel of expert is called as. So understand the question here. So there is a researcher who is giving questions to the panel of experts. So group of experts are there. Okay, 5 experts are sitting over there, and as a researcher, consider me as a researcher, I am giving a set of questions to each and every experts. Okay, so this is the question. So this type of method is called as what? So this is the question. So 4 options they have given here: Q sort methodology, content analysis, Delphi technique, and meta analysis. If you know the definition of each and everything, it will be easy for you to solve the question. Okay, so here the right answer is what? Any guessings? Option C, that is, okay, so mistakenly it happened. So option C, it is Delphi technique. What it is? It is Delphi technique, which is the right answer here. Option C, that is Delphi technique. So why I have selected this option? See, in a Delphi technique, what will happen exactly? As I mentioned already, I am a researcher, okay, using the Delphi technique. I want to gather the information. Okay, so from where I will gather the information for my research, I have to go and approach the panel of experts. I'm not going and asking any participants. Okay, if I am asking the views of the participant, that type is called as what? Q sort methodology. Option A. Okay, Q sort methodology. If I am thinking about the views of the participant, I am asking the opinion of the participant, means that is called as what? Q sort methodology. But here, according to this question, I am giving a set of questions to the panel of expert and I am getting the answers and I am coming to a conclusions. Okay, so that point is coming means a set of questions to a series of panel of experts. So these type of keywords are present in the question, means what you have to think? You have to think about what? Delphi technique. Okay, if the view of the participants, opinion of the participant, this kind of keywords are present, means you have to go for what? Q sort methodology. Okay, and what about meta analysis? See, everything is present here. Okay, Q sort methodology, I have given the definition. Delphi technique, I have given the meaning. Okay, so that it will be, if you want to pause and watch, read, so please pause and read the definitions and meaning also. Okay, meta analysis is very simple. So as a researcher, I'm going to review others' research. Okay, for example, I am doing one research, same like my research. 5 more people also already done the research. It is already there. Okay, so I am analyzing their point of view. I'm analyzing their results. Okay, and I'm combining their results with my results statistically. That is called as what? Meta-analysis. Okay, it is like a restudying. Okay, fine. So that is the one which is coming under meta-analysis. But here, according to this question, a panel of experts, I am getting the information from them. Then we have to go for what? Delphi technique. Okay, fine. The next question is, objective type test are related to express ideas. You know about objective test, right? So whatever you are giving in the NORCET examination, JIPMER examination, whatever the competitive examination, everything is coming under what? Objective type only. Whether you are going with the OMR sheet or you are doing in the CPT, doesn't matter. So it is coming under what? Objective type. So here the question is related to that only. So objective type tests are related to express ideas, easy to construct, highly structured, and low marker reliability. So it is a direct question, and here the right answer is option C, that is highly structured. Objective type tests are highly structured because it is like a one liner. Okay, in a single line 4 options will be there, or in a single line true or false option will be there, or it is like a match the following. Okay, so either among these 3, one will be there in the exams. Okay, so either it will be a multiple choice, that is objective type, or true or false, or like a matching type. So these things are highly structured, framed one. It is not like a paragraph, read for so many times and understand the concept. It is not like that. Okay, so it is highly structured because in a single reading you can understand what they are asking and what you supposed to answer. That's why it is called as what? Highly structured. The next question is a type of educational assessment which is generally carried out throughout your course or project is. A type of educational assessment which is generally carried out throughout. Throughout is the key point. Throughout your course. Okay, so here let's see the options. Very simple question, but so many times it is asked in the examination. Summative assessment, formative assessment, criterion referred assessment, and ipsative assessment. Let's see each and every rational. Okay, summative assessment. From the word itself, we can come to a conclusion that summative assessment means at the end of the course, they are conclusively assessing us, summatively assessing us at the end of the period. For example, you are studying in your college. In the college, only final exam is there. In between, there is no test is conducted. In between, there is no quarterly exams and half-yearly exams. Nothing was there. Directly, they are conducting the final exam. That is called as what? Summative assessment. At the end of the course, they are assessing you. That is called as what? Summative assessment. Okay. And the next one is formative assessment. Formative assessment means throughout the course. Okay, every now and then they are assessing you, evaluating you by means of conducting tests, by means of making you to attend the practical examination and theory examination. So they are assessing you from the starting of the course till the end of the course. It is called as what? Formative assessment. Every now and then they are doing the assessment. That is the difference between summative and formative. Summative means in the end they are assessing you, and formative means throughout the course they are assessing you. The next one is criterion referenced assessment. Criterion referenced assessment means it is a predetermined assessment. For example, if you take any school students, in the beginning of the, for example, a child, she is going to the 5th standard in the month of April. I'm giving an example. Once she entered inside the school, immediately they will be giving a diary. In that diary, they will be mentioning each and everything. So when will be the periodic test, the month, date, everything will be given. When will be the quarterly exam? When will be the periodic test 2? When will be the half-yearly exam? When will be the periodic test 3? When will be the final exam? When the autumn holidays will be there, summer holidays will be there, winter holidays will be there. Each and everything is present in that diary, right? So it is a predetermined, already planned one. That is called as what? Criterion referenced assessment. And the last one is ipsative assessment, comparing yourself with your previous exams. For example, last month I have written on, okay, leave those. Previously, I have written the ESA exam. I am giving an example. And now I have going to attend the AIIMS NORCET exam. So after completing AIIMS NORCET exam, I'm going to compare my development from ESA exam to NORCET exam. In ESA exam, I have scored 60%, means in NORCET exam, I have scored 80%. So comparatively, my performance is increased. Otherwise, in ESA exam, I scored 90%, whereas here in NORCET exam, only I have scored 50%. Okay, so comparatively, my progress is downward. Okay, so you are comparing yourself with your previous marks, previous assessments. So in that case, it is called as what? Ipsative assessment. Okay, and for this question, throughout the course, the assessment is taking place means it is called as what? Formative assessment. If the word predetermined is present means that time you can think about option C, criterion referenced assessment, but the predetermined is not mentioned here. So that's why we are entering inside what? Option B, that is formative assessment. Okay, I have given the meaning also for each and everything. Ipsative assessment, criterion reference assessment. Just pause the video and just check it out. Okay. The next question is, all of the following AV8s are a type of projectile aids except. So this image is not there. I have added this image. Okay. So here, what is the question is? It is an except question. All of the following AV8s are projected. They are asking all the options are projected AV8s except one. And they have given 4 options: epidiascope, diorama, microscope, slide projector. And here the right answer is option B, that is diorama. Diorama is not a projected aid, whereas epidiascope, microscope, slide projector, everything is a projected aid. So what is diorama? Here you can see the diorama in this image. It is a model. It is a model, okay, representing the actually it is a 3D dimension, 3-dimension model. It is representing a natural phenomena. For example, here you can see the boy is holding the model, 3D model of a solar system. It is representing the natural things for education purpose. So this is called as what? Diorama. It is not a projector. Projector means they will be displaying something and it will be displayed over the slides or a screen, right? So that is called as what? Projector. It is not a projector. It is a model, right? So diorama is a model, that is 3D model, which is very much useful for the education process. Okay, fine. So here you can see epidiascope. In this option, epidiascope is there, microscope is there, slide projector is there. You would have been known about the microscope, whereas slide projector and epidiascope, I would like to show the image because image based questions are very common nowadays. You can see here epidiascope. This is the epidiascope. Okay, and this is a slide projector. You can see the slides here. They will be keeping the slides like this. Okay, and the image will be viewed here. Okay, so this is called as what? Slide projector. So in the slide projector, what is present? Slide is present and it is projected in the screen. And this is the simple microscope. Hope everyone knows about this. Okay, so the next question is very interesting question. The art of applying the mock injuries for the purpose of training emergency response team medical personnel is called as. Very simple question. What they are saying is applying a mark injuries. You would have been known about the mark drill, fire mark drill. You immediately, if there is a fire, how you have to act, right? So it is an example what I'm giving to you. So it is actually there is no fire, but still they are making a drill. They are predicting if there is a fire, how you have to act. The same way here also, same like mark drill for fire, here also they are training the healthcare workers for mock injuries. If there is a mock injury suddenly happen, how as a healthcare worker, how as a nursing officer you have to act. Okay, so artificially they are using the mannequins. In other words, we can say it as in local term dummies. So you can see the mannequins. Okay, different type of dummies are there. Usually this dummy is very common, which we are used to practice the suturing, different types of suturing, right? Yes. So here this is also a dummy which is kept over the physician's hand. Okay, so if in this case there is it is like a wound, right? So if there is a wound, how to clean the wound? Okay, so how to do dressing over the wound? Okay, otherwise how to do suture over the wound? So what type of wound is there? It is a lacerated wound or a blunt wound. So each and everything we can learn by means of using these dummies or mannequins. One more name is also there for these dummies and mannequins. So that is the answer what we have to search here. Okay, so 4 options they have given here: exhibit, specimen, moulage, and model. So here, which is the right answer? Option C, that is moulage. So here the answer is wrong. Okay, so just neglect it. So actually, which is the right answer? Option C, that is moulage is the right answer. What is that? Moulage is the right answer. So moulage is nothing but it is a dummy or it is a mannequin. Okay, small mannequin which is used for the education purpose, used for the mock injury training purpose. Okay, so this is all about the question. So thank you very much for watching this video, guys. Hope this video is very much useful for you. We have discussed each and everything along with the rational and even the images. Image-based questions was also there. So please keep on watching this channel, keep on do revision, because each and every question whatever we have discussed is taken from the previous year question papers. So thank you very much for watching the video and all the best for your upcoming examination.